am a registered nurse as well as a certified health and lifestyle coach. I would say that the similarities to begin with is that the nurse needs to have very strong assessment skills. And the reason for that is two things. First, it's imperative to be able to understand the status of where the patient is currently and to be able to identify when those things change. The second thing would be having the knowledge as well as the skills to be able to assist this patient in meeting their goals. As well as differences, I would say trauma patients are very, very sick people. They are unstable in a lot of ways. Many of them need one-on-one nursing care. It's very intense, very involved patient care. Whereas with your neuro ortho patients, a lot of them, they're more stable. They will come in for more, I would say, elective surgeries. You know, maybe they come in for a hip replacement, a knee replacement, something like that. But overall, they're stable. First, I experienced trauma nursing. I worked at a level 2 trauma center. From there, I moved to California and worked in neuro ortho, and then on to hospice. And from there, I have currently launched my own business. So throughout my career, I would say mentors were the #1 reason for my success throughout the field. People who were excellent in what they did. Many of them had been in the field for 20, 30 years and were just great inspiration to me to be able to see what it was that I could do as a nurse, as well as to be able to take my own life to the next level. Well, as a registered nurse, I'll give you a few of the things that I would do every single day, and that is I need to do an assessment on all of my patients. So I need to have a baseline of where are they at, especially at the beginning of the shift. After that, I need to, call the doctor for any changes. I need to look at lab values, connect up with the family so that they have some idea, what is the condition of the patient, as well as to educate them on the diagnosis, as well as their goals. As a certified lifestyle coach, basically I work with clients one-on-one, and that means helping them to formulate a goal. A lot of them have a goal, what it is that they want to do with their life, or basically to take their life to the next level. So it would be identifying that, formulating a plan, as well as giving them support and resources along the way to be able to meet that. As in the field of nursing, it takes many, many skills to be a strong nurse. You have to be able to juggle very multiple tasks. You have to be at the top of your game all the time. So in the area of entrepreneurship, a nurse just brings a lot of skills with her into the field, probably more than from any other field. Some of those would be in the area of communication, teaching, education, leadership, to be able to multitask. Many nurses are self-starters. They don't, a lot of times you're not going to have a boss per se who is giving you your daily outline, something like that. You pretty much know what it is and how you're able to continue and adjust throughout the day to be able to meet those goals. There are many different challenges that nurses face, and as I just alluded to with the economy, I personally have nurse friends who are now the sole supporter of their family, meaning that likely their husband has lost his job, so they may be, instead of a 2-income family, they're now a 1-income family. So I would say from that perspective, nurses are more stressed. The second thing is nurses used to have more help in the field than what we currently do. And what I mean by that is in some organizations there are less nurse assistants being used. So the nurses are not only doing the critical care for the patient, meaning giving them their medications, their assessments, and these kind of things that nurses were trained to do, they are also assisting in taking their vitals, assisting them to the bathroom, feeding them, and those kinds of things. And the third thing is, I would just say time. To really be able to spend the amount of time that patients and family members need in education. With education, there are a lot of disease processes that can be prevented, especially in the area of health. And because of that, I think that there are a lot of concerns and questions that arise. Sometimes it could be easily dismissed or actually prevented if there would have been a little more time taken to be able to do that. I would say that nurses have a lot of opportunities. We are now moving in the technological stage of life. That means that computers, cell phones, iPads, these kinds of things are now becoming maybe even a form of existence. So there's just different opportunities now than what there ever has been. I really think that more nurses are going to be able to see the calling of entrepreneurship. There are many different fields out there that nurses can go into. Some of those would be finances, home-based businesses, wound care, legal nursing, health education, just to name a few of them. For myself, like many nurses, I never realized the amount of things that would be my responsibilities that would take away from direct patient care. Nurses are being given more and more responsibilities, especially with the economy being the way that it is. Hospitals as well are looking at how can they restructure basically to stay alive. So nurses are, given a lot of responsibility. For myself, that would definitely be the one thing that I would have enjoyed knowing probably a little bit prior to going into the profession. Throughout my years of experience, I have worked with many different people, all age, race, ethnic groups, socioeconomic status, all kinds of different people. And so I think that that was one thing that definitely assisted me, was the whole variety of range that I've worked with, as well as in medical care, when you work with doing assessments, what might be baseline with one person isn't with another. And so it's in realizing that each person is individualized. With all of my education, as well as the leadership from mentors that I have received, all of that assists me in starting my own business and in doing what I am today. I'm really further ahead. I have a shorter learning curve than if I would not have had that experience. I would say that for, especially a nursing student, one thing that really helped me was taking the Kaplan review course. That will assist them greatly in preparing to take the boards. For myself, I just felt that knowledge was invaluable. So that would be the first thing. The second thing is, I think that nurses need to commit to personal growth. And the reason I say that is because as nurses grow personally, it also affects them professionally. So not only are they able to grow as individuals, what they're able to give to their patients as well as to their colleagues, it's just a completely different level. So that's the next thing I would say. And the third thing I would say on that is, there again, they really need to look at their why. Sometimes I hear of students that are going into the profession, and the number one reason of what I hear they're going into the profession for is for the money that they think that it will bring to them. Now, on the days that patients and situations stretch them, they're going to need more than money to be fulfilled. One thing that I really see with nursing students is sometimes they go into the profession and they really don't know why they want to go into it or what they're going to get out of it. Healthcare is really, really changing. We see such a diverse amount of patients. Patients are sick, really, really sick, even on the med-surg floors now. Obesity is growing. Diabetes is a real problem. And so I think it's just very, very imperative for students to know why. And because you don't want them to get into the field and then to be disappointed.